My name is Boyd Shepard. I am faculty here at the University of Texas Health Science Center at Houston School of Dentistry. I am a director in the Office of Professional Resources in the PACE Center of the Office of the Dean here at the Dental School. I am also a clinical associate professor in the Department of General Practice and Dental Public Health. I have been on faculty here at the Dental School since 2007, and I have been in the practice of law, focusing primarily on representing Texas dentists in anything related to Texas dental law since 1994. I receive no financial benefits that would create a conflict of interest or restrict my independent judgment with regard to the content of this presentation. At any time while viewing the video streaming course, you can take a break by simply pausing your computer. At the completion of this section, you will be asked to take a short exam in order to complete the requirements for streaming video courses. At the time, you will receive instructions regarding taking the exam. Dental Practice Management through Regulatory Compliance, Part 1. State Board of Dental Examiners, Rule 108.7, Understanding and Implementing the Minimum Standard of Care. This online course is designed for dental practitioners to gain a greater understanding of the Texas Dental Practice Act and the rules and regulations of the Texas State Board of Dental Examiners, specifically State Board Rule 108.7, Minimum Standard of Care, so that they may implement the appropriate changes and systems in their day-to-day practice that ensures regulatory compliance with these rules and laws. Through understanding and implementation, the participant will also be managing the risks inherent in modern dental practice. Upon completion of this course, the participant will review, understand, and be able to apply the relevant provisions of the Texas Dental Practice Act and the Texas State Board of Dental Examiners rules and regulations. Be able to apply TSBDE Rule 108.7, Minimum Standard of Care, the focus of this presentation. Value ethical and legal approaches to clinical dentistry in your own practice. And review and implement the risk management procedures and protocols that will prevent patient complaints to the Texas State Board of Dental Examiners. Okay, so let's get started. Dental Practice Risk Management through Regulatory Compliance, Part 1, State Board of Dental Examiners Rule 108.7, Understanding and Implementing the Minimum Standard of Care. The Texas State Board of Dental Examiners performs three primary functions. Number 1, licensing of dentists and dental hygienists. Number 2, annual registration of all dentists, hygienists, and labs. And number 3, enforcement of Texas laws regulating the practice of dentistry. It is in this area of enforcement that forms the basis of our review of these rules for purposes of risk management. It's important for you, from a risk management perspective, to know where you can find a copy of the State Board rules. Where does one find the rules? The simplest way to obtain your copy of the State Board of Dental Examiners rules and regulations, as well as a copy of the Texas Dental Practice Act, is to simply go online and Google 3 words, Texas Board Dental. This will be a first step towards managing the risks of dental practice. Once you type in these 3 words, you will be able to access the Dental Practice Act, the Texas Administrative Code, which translates to the Dental Board's rules, The board policy statements, for example, their policy statement with regard to the use of Botox, State Board frequently asked questions, which are an excellent resource for a number of issues that come into dental practice on a daily basis and how those issues are handled by the State Board. And the State Board also provides forms that helps you, the licensed and regulated dentist, to be in compliance with the laws that do regulate your license. It's important to understand that State Board rules are changing, and they change without notice to you. The State Board is constantly reviewing the rules and working to improve on their efficiency, their interpretation, as well as to create new rules which will apply to dental practice that is relevant and current. It is important for you to understand how to get to the board website so that you can follow rules as they're changed or created. You can check the State Board website, and you can also subscribe to their newsletter at this email address on your screen. So, we've typed in Texas Dental Board, and we're doing a Google search to find the State Board website. Once that's entered in, we see that Texas State Board of Dental Examiners is the first item that comes up in our search. Click the main title, and you will be taken to the Texas State Board of Dental Examiners website. On the top menu bar, you will see the link for Laws and Rules. And once you click that title bar menu, which will pull down, you will see the links for the TSBDE rules. Once you click that link, you will immediately be taken to the Texas State Board of Dental Examiner rules, where you will be given two separate links. One allows you to read these rules in PDF format, and the other is a version that is off of the Texas Registrar and much easier to navigate online. This would be the top link on this particular slide. Once you click that link, you will be taken to a page that basically is a table of contents for the rules of the Texas State Board of Dental Examiners. In this presentation, we are focusing primarily on Chapter 108, Professional Conduct. Once you click the Professional Conduct link, Chapter 108, you will see that there are some subchapters to Chapter 108, and we will be focusing on Subchapter A, Professional Responsibility. And it is within this section, once you click this link for Subchapter A, Professional Responsibility, you will be taken to this page, which again is like a table of contents for all of the subjects covered in Chapter 108, Professional Conduct, Subchapter A, Professional Responsibility. For this presentation, we are focusing on Rule 108.7, Minimum Standard of Care. Please make note at this point also of Rule 108.8, Records of the Dentist, which will be presented in a separate CE online course. The reason I point this out now is because 108.7 and 108.8, these two rules cross-reference each other. You will see in 108.7 mention of the rule 108.8. When we get to 108.8, or in that video, you will see that 108.8 references 108.7. These two rules are very, very important to understand in context one with the other. So, getting into the rule. Texas Administrative Code, Title 22 Examining Boards, Part 5 State Board of Dental Examiners, Chapter 108 Professional Conduct, Subchapter A Professional Responsibility, Rule 108.7, minimum standard of care. Of note here is that if you had to go to a law library and try to find the State Board of Dental Examiners rules, you would have to understand and be able to research the Texas Administrative Code, which is possible to do online, and essentially what we're doing here through the State Board website. That is why it's so much easier and much more efficient to manage your risks by knowing how to get to the State Board website, because they can take you directly to the law that regulates your license. Rule 108.7, minimum standard of care. Also, as we read through this rule, something that's important to note is the source note given at the bottom of each individual rule. There you can find information on when a particular board rule was passed by the legislature or when it was last amended, and all of this can be found in this source note. That gives you a sense or an idea how long a particular rule has been in effect. In this particular rule, 108.7, minimum standard of care, it was last amended to be effective September 3rd, 2014. This is a relatively newly amended rule with changes that many Texas dentists are not aware of. Towards the end of this presentation, we will be looking at and discussing those changes, those amendments that were made effective September 3rd, 2014. Rule 108.7, minimum standard of care. This is the text of the rule. It begins, each dentist shall. Now, starting with those three words, please note when it says shall in the law is equated to must. You are obligated to. It does not say each dentist may or each dentist could. It says much more firmly and absolutely that each dentist shall. And Rule 108.7 sets out all of the things or all of the conduct that a Texas regulated licensed dentist must do. Each dentist shall, number one, conduct his or her practice in a manner consistent with that of a reasonable and prudent dentist under the same or similar circumstances. Some discussion about item number one. Reasonable and prudent is an expression or a phrase in the law that describes what the expectation is for a baseline level of conduct. You may ask yourself, who or how do I find or where is the reasonable and prudent dentist? Who is the reasonable and prudent dentist? How is reasonable and prudent defined? And reasonable and prudent is like I said, a legal phrase that expresses the concept that there's going to be a level of conduct that's expected amongst all of all Texas dentists, and we're going to call that conduct reasonable and prudent. Did the dentist act reasonably? Did the dentist act prudently? The analysis for the State Board of Dental Examiners is to look at the conduct of a Texas dentist and evaluate and analyze and ask, is the conduct of this particular dentist in these circumstances, was it in a manner that is consistent with that of a reasonable and prudent dentist under the same or similar circumstances? Is it the standard of care? The standard of care is what a reasonable and prudent dentist would do. Was that conduct reasonable? Was that dentist prudent in enacting that conduct? And is it consistent with what we would expect under the same or similar circumstances? So as you think about that, you then will arrive at the conclusion that this language is pretty broad. It's open to interpretation. What might seem reasonable and prudent to one person might not seem reasonable and prudent to another person at all. So there's this wide avenue of practice or conduct that might be considered reasonable and prudent. But in this situation, in this analysis, it is the State Board of Dental Examiners that regulates your license, that is in part of their function is to enforce the laws that apply to your license. They determine through their processes whether or not your conduct in any particular circumstance was reasonable and prudent. And so this language gives them the breadth or the width to evaluate that conduct. Number 2, each dentist shall maintain patient records that meet the requirements set forth in Rule 108.8 of this title, relating to the records of the dentist. As I was saying before on the previous slide, Rule 108.8 and Rule 108.7 go together. And in this instance, they are specifically saying that Rule 108.8 sets out the rules with regard to record keeping, but record keeping must be done pursuant to 108.8, and it's the maintenance of those records pursuant to that rule that we consider to be part of the standard of care. And I want to make the distinction. Typically, you would think of the standard of care applying only to treatment. We think of dental clinical treatment to be what is analyzed pursuant to the standard of care. But the standard of care under the Texas State Board of Dental Examiner rules includes how a Texas dentist maintains patient records. Again, each dentist shall maintain patient records that meet the requirements set forth in 108.8 of this title relating to records of the dentist. So not only is a Texas dentist treatment and the conduct associated with that treatment analyzed under the minimum standard of care, but also the maintenance of patient records that records that treatment is analyzed not only under record keeping 108.8, but also 108.7 minimum standard of care. Rule 108.7, subpart 3, each dentist shall maintain and review an initial medical history and perform a limited physical evaluation for all dental patients. In this particular rule, there's two phrases, initial medical history and the phrase limited physical evaluation. What do these two phrases mean? Well, certainly you understand what a medical history is, but it's keying in on the word before medical history, and that is initial medical history. Then takes us to subpart A of this subpart 3, which states that the medical history shall include, but not necessarily be limited to, known allergies to drugs, serious illness, current medications, previous hospitalizations, and significant surgery, and a review of the physiologic systems obtained by patient history. A checklist for consistency may be utilized in obtaining initial information. The dentist shall review the medical history with the patient at any time a reasonable and prudent dentist would do so under the same or similar circumstances. So, to review with regard to obtaining a medical history as part of the minimum standard of care. Rule 108.7, subpart 3, states that a Texas dentist shall maintain and review an initial medical history. The word initial means that you must take a medical history at the time of the first appointment of any patient. The only exception would be in the case of an emergency where there's no time to take a medical history, and in that instance the clinical notes or the progress notes must state that fact, that you were not able to get the medical history and the reason why. Outside of that exception, the State Board of Dental Examiners rules require each Texas dentist to obtain a medical history at the initial or first appointment. And then the rule in subpart 3A lists out all of the items that must be included or shall include in that medical history review. What's good about this rule is that it does clearly state that a checklist may be utilized for obtaining an initial information. Most records of Texas dentists, whether they be electronic or hard copy, is set up to take a medical history in this checklist style. In all likelihood, your records, whether it's electronic or hard copy paper charts, will have or include a checklist style medical history that will be compliant with the state board requirement. What's more difficult is this last sentence. The dentist shall review the medical history with the patient at any time a reasonable and prudent dentist would do so under the same or similar circumstances. The rule requires, according to its text, that the dentist review the medical history with the patient, and that the dentist do such a review at any time a reasonable and prudent dentist would do so. So this medical history starts with a baseline or an initial input of the information at the first appointment, and then the state law expects and requires a Texas dentist to review that medical history as often as a reasonable and prudent dentist would do so. The question is, how often does that require a Texas dentist to do that? That's what we'll talk about in a few slides. However, we need to cover the definition of limited physical evaluation and what that means. Again, Rule 108.7, Subpart 3, a Texas dentist or each Texas dentist shall maintain and review an initial medical history and perform a limited physical evaluation for all dental patients. The limited physical examination, which is synonymous with evaluation in the first part of the rule, the limited physical examination shall include, but shall not necessarily be limited to, the measurement of blood pressure and pulse, heart rate. So the State Board of Dental Examiners expects that each Texas dentist to record the blood pressure and pulse at a minimum for each patient. Blood pressure and pulse, heart rate measurements are not required to be taken on any patient 12 years of age or younger unless the patient's medical condition or history indicates such a need. So on every patient 13 years of age or older, it is expected that in the clinical progress notes or somewhere in the chart where it is appropriate, a dentist must record the blood pressure and pulse of that patient beginning with the initial appointment. The rule does not use the word initial in front of the limited physical evaluation, which we know to be blood pressure and pulse, heart rate. However, it is interpreted and understood by the State Board of Dental Examiners that the word initial in the beginning of this Rule 3 applies not only to the medical history, but the word initial also applies to the limited physical evaluation requirement which is the blood pressure and pulse. To be clear, the first appointment for any patient in Texas in a dental examination in the progress note for the first appointment, blood pressure and pulse must be recorded there. Subpart 4, each Texas dentist shall obtain and review an updated medical history and limited physical evaluation when a reasonable and prudent dentist would do so under the same or similar circumstances. This is the part of Rule 108.7 that is telling you how often a Texas dentist must review and update the medical history, as well as update or obtain new readings for the blood pressure and pulse for the limited physical evaluation. And the frequency is as often as a reasonable and prudent dentist would do so under the same or similar circumstances. It then goes on to say that at a minimum, a medical history and limited physical evaluation should be obtained and reviewed at the initial appointment and updated annually. So it's being very clear here in Part 4. It's expected at the initial appointment for both the medical history as well as the blood pressure and pulse, and at a minimum should be updated annually. However, for risk management purposes, if doctors only update these pieces of information annually, there's a very high likelihood that they will not be in compliance with the state board rules, because the baseline is not to update this information annually, but rather to do so as often as a reasonable and prudent dentist would do so under the same or similar circumstances. This part of the rule allows the doctor to be the doctor. In all likelihood, whether or not you take blood pressure and pulse will be directly connected and related to the information gathered in the medical history. No two patients are the same. As an extreme example, you may have one patient who comes in who is in extremely good health, is young, has no medical history, has no medical problems or issues whatsoever, is basically in a level of athletic fitness, and their oral health is excellent. In all likelihood, you could take their blood pressure and pulse at the initial appointment and then not need to take their blood pressure and pulse again for another 12 months based on a short review of their medical history at each subsequent appointment. Let's say they only came in for 3 or 6 month recalls and their medical history was updated and there had been no change. Technically, you could argue that there was no reason to take a blood pressure and pulse because they were in excellent health at their initial appointment as well as at their recall appointment. By contrast, you may have a patient who comes in who is clearly medically compromised. They list on their medical history medications for a heart condition or any other physical condition that may be contraindicated for certain types of dental treatment under certain circumstances. In those types of patients, a reasonable and prudent dentist would most likely take their blood pressure and pulse at each appointment. And they would want to stay on top of and update that medical history at each appointment. So those are two extremes that say you, the doctor, must be the doctor on a patient-to-patient basis. How often do you need to update medical history and obtain blood pressure and pulse? Well, you do it as often as a reasonable and prudent dentist would do so under the same or similar circumstances, which means you evaluate the patient, what their medical condition is, what their medical status is, and then act accordingly and act appropriately based on that information. Do not rely on the part of the rule that says at a minimum update annually, but rather update as often as the circumstances dictate based on that patient's medical history and status. Moving on then. Subpart 5 of Rule 108.7 Minimum Standard of Care says that each dentist shall, for office emergencies, A, maintain a positive pressure breathing apparatus, including oxygen, which shall be in working order. B, maintain other emergency equipment and/or currently dated drugs as a reasonable and prudent dentist with the same or similar training and experience under the same or similar circumstances would maintain. C, provide training to dental office personnel in emergency procedures, which shall include but not necessarily be limited to basic cardiac life support, inspection and utilization of emergency equipment in the dental office, and office procedures to be followed in the event of an emergency as determined by a reasonable and prudent dentist under the same or similar circumstances. And D, shall adhere to generally accepted protocols and/or standards of care for management of complications and emergencies. Beginning with 5A, each dentist shall, for office emergencies, maintain a positive pressure breathing apparatus, including oxygen, which shall be in working order. The ideal positive pressure breathing apparatus would be the small oxygen tank. In most dental offices that I've seen, this is a small oxygen tank that has the mask attached and can be moved around the office on a small cart that's fitted for that tank on 2 wheels. That's the most efficient, but not necessarily the standard of care, in the sense that you could also have a manual ambu bag that would give you that positive pressure as well. But just for risk management relative to patients, the best positive pressure breathing apparatus would be the mobile oxygen tank. With regard to maintaining other emergency equipment and/or currently dated drugs as a reasonable and prudent dentist with the same or similar training and experience under the same or similar circumstances would maintain, 2 items of note there. Training and experience is going to be related to most likely whether or not these are emergency equipment or currently dated drugs that a general dentist would keep in their office versus specialist, let's say an oral surgeon. Depending on the type of practice that you have and the type of dental procedures that you perform, whether they are general or specialty, may dictate the type of emergency equipment and currently dated drugs that's expected to be in any dentist's particular office. The second thing of note is that the dental board does not provide you with what they expect at a minimum, what types of emergency equipment or currently dated drugs that they expect you to have specifically. This is very broad language in that sense. The board has given themselves the room to evaluate your type of practice and what you should, in their opinion, have in your office with respect to emergency equipment or currently dated drugs. My advice, and the advice that I've given over the years, is you can find this type of information easily online by looking up or searching for emergency equipment for dental practices or dental offices, as well as drug use or drug prescriptions for dental offices, common drugs utilized in dental offices. Any type of search like that should get you a list. However, the obligation for you to then evaluate and do an analysis of whether or not that is the emergency equipment that is appropriate for your office or the currently dated drugs that is appropriate for your practice will solely be on you. In all likelihood, it'll be that you draw from several resources and then put together your own customized list of items to keep in your office, both as to emergency equipment and currently dated drugs. Of note here, when Investigators for the State Board of Dental Examiners, if they ever come to your office for whatever reason based on a patient complaint, in all likelihood they will do an inventory of your office to see if you're in compliance with Rule 108.7. On their checklist for their in-office visit investigation, one of the items that they are looking for is whether or not you have this emergency equipment and currently dated drugs that would be expected to be in your office. In that respect, not only do you want to be in compliance by having these items stated in subpart 5 of Rule 108.7, but you're also, in my opinion, it would be good for you to have an inventory of the equipment as well as the drugs written out or in a spreadsheet so that you can produce that easily, quickly, and efficiently to show that not only do you have the equipment, but you have an inventory list of everything that you have there in your office. The same would apply to subpart 5C in providing training to dental office personnel in emergency procedures. It would be good for you to keep a record of that training of all of your dental office personnel by name, the date that they were trained, and the emergency procedures that they were trained in, including basic cardiac life support, inspection and utilization of the emergency equipment that you have there in the office for subpart 5B, and the office procedures to be followed in the event of an emergency. All of these items should be in writing, kept as logs, and easily produced so that in the event that there's a patient complaint that results in or requires a visit from a State Board of Dental Examiners investigator, that you would be able to produce that information in a very efficient way. This would go a long way towards minimizing or mitigating a complaint, if not having the complaint dismissed outright, because of how organized you are in maintaining this information. Finally, subpart D of 108.75 says each Texas dentist shall adhere to generally accepted protocols and standards of care for management of complications and emergencies. This is another example of very broad language that is basically tacked on to the end of this rule that says A, B, and C are very, very specific of what we're looking for to be in compliance with the standard of care as to office emergencies. But in the event that we need to cover something else that helps protect the dental patient, a Texas citizen, we're going to have this broad language in 5D that states that basically we expect you to adhere to generally accepted protocols for the management of complications and emergencies. So understand, management of emergencies and their complications is not only covered under the standard of care, but very, very important to be able to demonstrate that you're doing all that you can to be in compliance with this part of 108.7. Minimum standard of care under Rule 108.7 also states that each Texas dentist shall successfully complete a current course in basic cardiopulmonary resuscitation given or approved by either the American Heart Association or the American Red Cross. Each Texas dentist should recognize this requirement from your annual registration, basically checking the box as to whether or not you are current on your basic CPR course, which actually will last for 2 years, but it is a requirement under this rule that you be current in your basic CPR instruction. Rule 108.7, minimum standard of care. Each dentist shall, number 7, maintain a written informed consent signed by the patient. This is the part of the state board rules that requires informed consent. And understanding the rule will go a long way towards the minimum amount of risk that you would experience in staying compliant with state board rules. So, starting again, each dentist shall, number 7, maintain a written informed consent signed by the patient or a parent or legal guardian of the patient if the patient is a minor or the patient has been adjudicated incompetent to manage the patient's personal affairs. A signed, written, informed consent is required for all treatment plans and procedures where a reasonable possibility of complications from the treatment planned or a procedure exists, or the treatment plans and procedures involve risks or hazards that could influence a reasonable person in making a decision to give or withhold consent. Such consents must disclose any and all complications, risks, and hazards. So, going back through the rule. Subpart 7, with respect to informed consent required for each Texas dentist to obtain from each patient. The written informed consent, first of all, must be written. It cannot be verbal. You cannot obtain informed consent in Texas verbally. All informed consent must be recorded in the patient chart in a written format. This written informed consent must be signed by the patient or the parent or legal guardian of the patient if the patient is a minor. A couple of things there. If the patient is a minor, it says either the parent or their legal guardian. A grandparent, a relative, a sibling, anyone other than what's listed in the rule, parent or legal guardian, would not be appropriate or compliant with this rule. You must have it signed by, if the patient is a minor, signed by a parent or legal guardian. Legal guardian is going to be defined as someone who has actual court-ordered guardianship over the patient. If a grandparent is attempting to sign off on a minor patient's informed consent, but they don't have court-ordered legal guardianship over that patient, then a grandparent's signature on a informed consent is technically not compliant with the state board rule. Another issue that comes up is whether or not a minor patient, if they're in the office and you're trying to get informed consent, but the parent is not there for some reason, and the minor has either been dropped off or has been brought by someone not a parent or legal guardian, how do you get informed consent? Can you exercise other alternatives to get that informed consent from a parent who's not physically in the office before proceeding? Technically, the answer would be no. You cannot get informed consent either by fax or email or verbally over the phone. Why? Because it says the informed consent must be signed by the patient or parent or legal guardian of the patient if the patient is a minor. And getting that signature and then having it transmitted by email or by fax, although arguably sufficient, may technically not be in compliance with the rule, and so that is something that I would advise against. Anything other than a physical in-person signature by a parent or legal guardian if the patient is a minor. You'll also note that there's nothing in this rule that says that you have to have the signature of the treating doctor. Informed consent does not need to be signed or co-signed by the doctor. The only legal requirement is that the informed consent is signed by the patient. You'll also note that the rule does not require the signature of a witness to the signature of the patient. Again, the rule only requires the signature of the patient or parent or legal guardian of the patient if the patient is a minor. Obviously, if the patient has been adjudicated incompetent to manage the patient's personal affairs, it is highly likely that that particular type of patient will have a court-ordered legal guardian to manage that patient's affairs. Moving on to the next sentence in the rule. A signed, written, informed consent is required for all treatment plans and procedures where a reasonable possibility of complications from the treatment plan or procedure exists, or the treatment plans and procedures involve risks or hazards that could influence a reasonable person in making a decision to give or withhold consent. All of that to say that the analysis of this particular sentence as to what procedures require informed consent should be asking yourself, what treatment do I perform for my dental patients that does not or do not have a reasonable possibility of complications? What treatment is there? What dental treatment is there where there is no reasonable possibility of complications from the treatment? From that analysis, there are only a very few, a small handful of dental procedures that do not carry some reasonable possibility of complications. How do you define complication? What is a complication? In my experience, anything that would involve any type of invasive procedure, anything where there is going to be blood present, would be the level where you would draw the line as to the criteria of whether or not something is considered to carry a level of complications requiring informed consent. My advice has always been to be as conservative as possible, to always view the rules from the most conservative position. To obtain informed consent from the most conservative position says that I'm going to obtain informed consent if there's any possibility of a complication. The rule states where there's a reasonable possibility of complications, so if I look at it from just a mere possibility rather than a reasonable possibility, that puts me in a default position to most likely being incompliant, because I'm saying that most, if not all, dental procedures carry some level of a possibility of complications. The dental board in a complaint situation will analyze this interpretation from the most conservative position. Their job is to protect the citizens of the state of Texas, to protect the patient, to regulate your license, to enforce the law that regulates your license. And in so doing, they will hear and understand or why you did not get informed consent, but from a conservative position, they may not agree that there was not a possibility of complications. So, bottom line, the advice is for written informed consent under Rule 108.7, always analyze whether or not you should obtain informed consent from the most conservative position and from a position that is more likely to protect the patient. Another thing to note with informed consent is when you are obtaining informed consent and a patient is signing off, that informed consent should be reviewed by the dentist with the patient. Many dentists will delegate informed consent to another office staff member to obtain, or they will have the informed consent presented to the patient, but no one will go over the informed consent with the patient, and the patient is left to review and read the informed consent themselves. This is not informed consent. This is not the obtaining of informed consent. Texas dental practitioners should always think of informed consent and the obtaining of informed consent as a dialogue, as a conversation between the doctor with experience, education, and expertise in the dental procedures to be performed and the patient. The patient is going to have questions and will not fully understand every nuance or every thing that they need to know about any particular procedure, even if it's spelled out in the informed consent, because they don't have the expertise, the experience, and education that you do. Informed consent should be reviewed by the doctor directly with the patient. And any questions about the informed consent, anything that comes up of note in that discussion, ideally should be noted in the progress notes as well. Another issue that pops up with informed consent is the situation where you may present a treatment plan to a patient on any particular date, but you actually don't do the procedure until 2 weeks later. For example, you might present a treatment plan on January the 15th that includes the extraction of 2 maxillary teeth in 2 separate quadrants. And you may actually present and get approval of that treatment plan on January the 15th, but for whatever reason you cannot begin treatment until January the 30th. And so the patient comes in for those extractions on January the 30th. They are given an informed consent that they signed back on January the 15th and dated January the 15th when they were presented the treatment plan. The question is, does that informed consent legally comply with Rule 108.7? And the answer is no. Informed consent should be obtained under the law on the same date contemporaneous with the date of treatment. It is not compliant to obtain informed consent for any treatment other than on the date of the actual treatment. Another issue that goes beyond this point is if for some reason you are unable to extract both teeth of the maxillary, that you are only able to do the left quadrant of the maxillary and not the right, and for some reason you have to reschedule for that second tooth, do you need to get informed consent again, even though both teeth were listed on the original informed consent? And the answer is yes. The patient comes back another 2 weeks later in the middle of February to have that second tooth extracted, then a new written informed consent should be obtained at that time. Informed consent, as far as informed consent forms and what will be compliant. First of all, the dental board does not provide you with any informed consent forms that they consider to be compliant. Rather, they give it to you through this particular rule to determine what your informed consent will say within these guidelines. They tell you what they expect, that the informed consent needs to describe the risks and hazards that could influence a reasonable person and must disclose any and all complications, risks, and hazards. But beyond this description and this guideline, the dental board does not give you any specifics on any particular type or of informed consent or any particular type of treatment and how that informed consent should look. My advice has always been, particularly for general practitioners, the best informed consent that you can obtain, other than something that you might draft yourself within these guidelines, would be from the specialists that you refer your patients to. For your endodontic procedures, the best informed consent that you can probably obtain will be the informed consent that's utilized by the endodontist that you refer endodontic work to. Apply that to each specialty. Each type of specialist that you either refer to or might refer to, in all likelihood, will have an informed consent form that is the best informed consent that you could have for that particular area of dentistry. Finally, Rule 108.7, subparts 8 through 15. These are grouped together because they are the last part of Rule 108.7. These items were added on September the 3rd, 2014. These are the amendments that were added that are noted in the source note at the end of the rule if you look at the rule online and that we pointed out earlier. All of these subparts were added on September the 3rd, 2014. Subpart 8, safeguard patients against avoidable infections as required by this chapter. And you'll note on this slide that I've highlighted as required by this chapter, not only in subpart 8, but also in 12, 13, 14, and 15. Anywhere you see as required by this chapter, these are rules that are actually addressed in more detailed rules on these subjects in another area of the state board rules, in another chapter of the state board rules. And what the state board has done is they have brought these particular subjects covered in a completely different chapter of the board rules, and they've engulfed them or enveloped them into the standard of care. So, safeguarding patients against avoidable infections is actually covered in a different chapter, but to do so is considered part of the standard of care. Moving to number 12, 13, 14, and 15 in this same respect. Patient death and hospitalization is covered in Rule 108.6, but it is within the standard of care now since September the 3rd, 2014, to be compliant with that reporting of patient and death and hospitalization. Similarly, the rules that address sanitation or patient abandonment, which is Rule 108.5, these are addressed in other parts of the state board rules, but now those requirements with respect to sanitation or the requirements in the reporting or the avoiding of patient abandonment is also covered in minimum standard of care Rule 108.7. Requirements concerning notification of discontinuation of practice also now enveloped within the standard of care. Subparts 9, 10, and 11. With respect to number 11, maintaining a centralized inventory of drugs, that is something that goes back to subpart 5 of this rule. And I was mentioning it would be prudent for you to keep an inventory of the drugs that are utilized in your office. Now, since September the 3rd, 2014, it is the minimum standard of care to maintain that centralized inventory of drugs. It's been articulated specifically within the rule. And finally, subparts 9 and 10. This is very, very broad language. For a dentist to not be negligent in the provision of dental services and to use proper diligence in their dental practice, not only broad but arguably redundant, but the state board is basically saying we're going to analyze your conduct from a perspective of negligence as well as whether or not a particular dentist in a particular situation, case, or treatment used proper diligence. And that objective perspective leaves a lot of room for potential enforcement and non-compliance, but at the same time, that's the law in the state of Texas under this Rule 108.7. Just pointing out again, all of those last items on the previous slide, 8 through 15, were added on September the 3rd, 2014. A relatively short period of time and relatively recent as far as board rule changes are concerned. So, if you need any clarification on any of the foregoing, if there's anything that you need an answer to your questions with regard to Rule 108.7 of the State Board Rules and any of the discussion that's presented in this course here on this video, please send an email to utsdcontinuinged@uth.tmc.edu. Direct it to me, Boyd Shepard, and I'll do my best to respond to your question and clarify anything that you have a question about. I have demonstrated for you how to locate the State Board rules. And the references for this course come directly from that same source, the State Board rules that you can find on the State Board website for the Texas State Board of Dental Examiners. This completes Dental Practice Risk Management through Regulatory Compliance, Part 1. Texas State Board of Dental Examiners Rule 108.7, Understanding and Implementing the Minimum Standard of Care. Now, you will take a short exam in order to complete the requirements for streaming video courses.